I want to bring in Massachusetts Congresswoman Katherine Clark, the House Democratic Caucus Whip. Thanks for joining us. Look, I wonder if I can pick it up there. And I wonder if in the conversations you're having with your members, you are hearing talk about maybe can there be some compromise on the idea of an off-ramp, as Ali put it, on ACA subsidies?
You know, that has been our absolute message, Chris, to Republicans, to the president, and to the American people. Let's get together. This shutdown that they have inflicted on our country is entirely preventable. But we have been waiting since March for them to come and work with us. And every step of the way, they have made life harder and more expensive for Americans, particularly when it comes to driving up the cost and reducing access to health care. So we are here today in an empty Capitol of House Republicans. They're nowhere to be found. But we are going to be here to create a negotiation anytime they will meet with us.
I know that nobody likes to pre-message a negotiation, but are you suggesting that there is room for compromise, that there could be a deal that's still made, on which Democrats will move?
Of course. That's the point of negotiation. Listen, what we are saying.
Where would you be willing to give, for example?
Yeah, well, here's where we are not going to negotiate against ourselves. What we have said to them is that we are here and waiting. We have watched you take 20 million people off their health care. Today, notices will start going out about incredible increases, up to 75%, 93% increases in premiums. Those notices are starting to go out in the next few days, and Americans are looking at no way to help them pay that. So this is an impending crisis. We would welcome them coming and saying, we get it. We have to do better by the American people who are already telling us they cannot afford the basics. That's what most American households are struggling with. So, of course, we are open to negotiation. And what they have chosen to do is shut down government, further hurt our economy, further punish federal workers, further punish the American people who rely on their services, instead of coming to the table and saying, let's do better by Americans and their health care.
So let me ask you about what Senator Thune had to say. He claims Democrats in the Senate are weakening. Your job is to track Democrats in the House. Do you see signs of cracks on your side? Do you hear concerns that if this goes on, that it may become untenable?
I do not, because this is the situation that we are in. We have seen this president and his administration undo bipartisan agreements on how we spend hard-earned tax dollars to benefit American people. They are doing that already unilaterally. They are saying to the American people, here is the deal that Republicans have put in front of you. We will cut your health care in order to give tax benefits to the very wealthy. If they want to come and defend that to the American people, that is on them. What we are saying is that is a bad deal for the American people. That is not something that we can live with and rubber stamp an extreme budget that continues those health care cuts. So let's come to the table. And the response we got from Speaker Johnson and House Republicans is that they canceled session. It is not, they are saying it is not even worth coming in and doing our jobs. That's not disrespectful to Democrats. That's disrespectful to the American people whose voices they are cutting out of this process.
At least one of your Democratic colleagues, Congresswoman Debbie Dingell, told our Ali Vitale she's going home to Michigan for 24 hours. She's going to talk to TSA agents, to air traffic controllers, meet with other government employees who are being impacted by this. Two-part question. Is this part of a larger strategy we could see from other House Democrats? And is it maybe a sign that some members are worried that your case hasn't yet made its case. Your side hasn't made its case to voters.
Listen, we are going to have a continuing dialogue with the constituents. And, you know, we are seeing that
including
from
going home and
across...
talking to them face to face?
Exactly. That is what we have been doing since the Republicans proposed these Medicaid cuts. And that is why you see that their bill is so profoundly unpopular, that these cuts are so devastating. And those are conversations we are having with our constituents at home. Of course, we are going to talk to the federal workers that this Republican shutdown are going to directly impact. But we are going to continue having the dialogue, whether that's town halls or hearings, showing up at places of business, talking to the American people on what they're experiencing. And I can tell you, Republicans would be wise to do the same, because the stories aren't just coming from blue parts of this country. They're coming from every part. That people are afraid they're going to have no place or way to pay for the birth of their expected baby. That they are worried that the cancer treatment they're undergoing or their loved one is no longer going to be able to be continued because they're not going to have the health care. I'm hearing overwhelmingly from small business owners that the ACA is what allows them to keep their business afloat. They are not sure they can do that under the double whammy of the ACA premiums exploding in cost and the tariffs that this administration has applied. So we will always be in conversation with the American people, because that is what this fight is about, making sure that we can lower their costs, save their health care, and ensure they have opportunity they deserve.
Congresswoman Katherine Clark, thank you.